Come in.
Hello. My name is Malia, and I'm a student nurse at SEMA, and I'll be taking care of you today. First, let me perform hand hygiene. Now, before I begin, would you please tell me your name and your date of birth?
January 7th, 1946.
And what's your name?
Mrs. Jenkins.
Thank you. Okay, Mrs. Jenkins. So, today I am here to administer your medication, Coumadin. Coumadin is an anticoagulant which prevents your blood from clotting. Now, the reason you are taking this medication is for your past medical history of atrial fibrillation, which is irregular heartbeat, and hypertension, and also type 2 diabetes. And I am giving you this medication to decrease your risk of getting a blood clot. So, some common side effects to watch out for would be blood in urine, vomiting blood, and watch out for tarry stools, that can look dark red or black in color. And also watch out for petechiae, which is this like dotted rash that appears underneath your skin. Do you have any questions so far?
No.
Okay. Well, I would like you to rate your pain on a scale of 1 to 10, 1 being the lowest and 10 being the worst you've ever felt.
5.
A 5. Okay. And have you had any recent side effects with this medication or anything you'd like to talk about?
No.
Okay. Well, there are a few more things I would like to teach you about this medication before I give it to you. Now, you do not want to take this medication with aspirin. And also, if you are eating foods high in vitamin K, which is green leafy vegetables, then this could decrease the effectiveness of the Coumadin. Okay? Any questions?
No.
Okay. So, before I give Miss Jenkins the medication, I need to perform 3 checks. The first medication check, I will be taking the medication out of the dispenser and checking it against the order. So the order says Coumadin 2.5 milligrams PO, and the label says Coumadin 2.5 milligrams. So the first check has been completed and it is correct. The second check I will do is whenever I pour the medication into its wrapper. And once I do that, I will then check the medication again against the order. And the order says Coumadin 2.5 milligrams PO, and it says 2.5 milligrams Coumadin, which is correct. Okay. And then, before I administer the medication, I will need to make sure that Mrs. Jenkins is sitting up in a comfortable position, ready to take her medication. So would you like to sit up, please? Thank you. And do you have a way that you want to take this? Do you want to take it all together or one at a time?
Just one at a time.
And are you okay with swallowing medication?
Yes.
Okay. I'm going to give you the medication and the water, but first, before I hand her the medication, I'm going to check one last time that this is the correct. So it says Coumadin 2.5 milligrams PO, and then the medication is Coumadin 2.5 milligrams. And we have 2.5 milligrams in here. So you can go ahead, and I'll give Mrs. Jenkins as much time as she needed to take her medications, assisting her in any way that I can. And after Mrs. Jenkins has taken her medication, I will check to see that she did in fact swallow her medication. Would you please open your mouth? Yes. And did you have any difficulty swallowing?
No.
Okay. So after Mrs. Jenkins has then taken her medication and I have ensured that she has swallowed it, then I will assist her back into a comfortable position. You may lay back down. Make sure she's covered up, that the bed is in the lowest position, the guardrails are up, and that her call light is in reach. And then I will then perform hand hygiene once again before I leave the room, or as I'm leaving the room. And then as soon as I leave the room, I will go over to document that I gave Mrs. Jenkins Coumadin 2.5 milligrams PO at 1800. My name is Malia, and that was my medication administration video.